All right, now it's time for the keynote speech. It is my pleasure to introduce our keynote speaker, Jung-Suk Park. She is a Dean of Nursing College at Keimyung University and had a PhD in Yonsei University. She is currently president of Korean Oncology Nursing Society, advisory member of Korean National Cancer Management Committee, and chief in accreditation team, Korean Accreditation Board of Nursing Education. She earned Minister of Health and Welfare citation in 2011 and 2014. Korean Nurses Association Academic Excellence Award in 2016, and even Daegu Mayor citation in 2017 and 2018 twice. As a very experienced nurse and professor, she is going to talk on the face of COVID-19 and the role of health professionals. Ladies and gentlemen, I'd like to extend a warm welcome to her.
Good morning, ladies and gentlemen. It is my great honor to give a keynote speech at the wonderful, this 5th Allied Health Science International Symposium. I would like to thank you, President Seung-hee Nam, for inviting me. The topic I'm going to discuss today is face of COVID-19 and the role of health professionals. As you can see in the table of contents, we will have a look at the brief history of COVID-19 pandemic and its symptoms. And we will also review the role of health professionals in the face of prevention, screening, treatment, follow-up, and end of life, I classified. 2020 was a very particular year in the human history. The whole world has stopped. We couldn't hold other people's hand anymore. Spending more than 1 year in such a state has brought about many changes in individual, families, workplace, society, country, and the world. My favorite TV show, Mr. Rod. Do you know Mr. Rod? Yes. Mr. Rod was actually filmed without audience, but surrounded by online viewers from around the world, which gave me more excitement and joy. These changes will continue until COVID-19 comes to an end. We will never be able to go back to the life before COVID-19. Let's look at a brief history of the COVID-19 pandemic in Daegu, Korea, and the world. Daegu, where we are currently holding this conference, is a city hit hard by COVID-19, and citizens have teamed up to overcome mass infection successfully in 2 months. On February 18, 2020, the first patient confirmed in Daegu, also known as the patient number 31. She was a super spread. From February 19, the number of patients increased sharply on February 21st, 2 hospitals were designated to solely deal with the infectious disease. One of them, Keimyung University Daegu-Dongsan Hospital, as an affiliated to the university where I work. I'm very proud of that. On February 29th, 741 COVID-19 cases were reported, reaching its peak. From February 18 to April 10th, a total of 6,807 COVID-19 patients were confirmed in Daegu area. In a paper published in the International Academic Journal, Virology Current Research in April 2020, it was argued that we should pay attention to the 40-degree north latitude region, as the number of the COVID-19 infection were high in Italy, Korea, and Iran. The Korea is very notorious at that time. The first medical personnel who entered the world of COVID-19 patients in Daegu-Dongsan Hospital were one experienced head nurse and one internal medicine infectious disease specialist doctor. She is the head nurse, the first woman to come to the patient. They bravely entered the patient room to fight an unknown novel infectious disease. Some personnel left the hospital in fear of COVID-19. So the remaining nurses had to take over everything. That's a very hard job. AFP reporter Ed Jones interviewed a nurse at Daegu-Dongsan Hospital and said the Korean nurses' bandage have become badge of honor. You might think that the nurse put Band-Aid on their faces because they got wounded. No. In fact, it was a wise choice to prevent the goggle and face shield to leave deep pressure on here in faces, to take over, leave press mark and hurt their faces. It's prevention. They chose the Band-Aid. During the first wave of the pandemic in February and March, Korean government did not order an official lockdown of Daegu. Instead, Daegu citizens went into high level of self-quarantine to cope with the infectious disease. Parents in Daegu told their children living other cities, never come to Daegu, and I want to go anywhere. Such effort contributed in blocking further spreading of COVID-19. With the end of the first wave, the director of the nursing department at Daegu-Dongsan Hospital won a proportional seat at the National Assembly and is currently working on legislative activities in relation to the infectious disease and promoting public health. Also, Daegu citizens are said to have protected the city by becoming the strongest vaccine themselves, ourselves. Next, let's have a look at the current situation of the COVID-19 pandemic in Korea. The first wave took place in February and March, and the second wave in August and September, third wave in December, and this year, January, and continued on. Korea shows its first confirmed COVID-19 cases in January 20th, 2020. the Korean government has installed COVID-19 screening station at public health center and large hospitals nationwide to find patients quickly. It is the first of its kind in the world. As previously mentioned, the February 2020 is the first wave of mass infection broke out in Daegu area. At this time, to accommodate a large number of the patients due to the sudden outbreak, Korea opened the world's first residential treatment center for mild patients. In March, the WHO officially declared the COVID-19 pandemic worldwide. The Korean government implemented a 5-day rotation face mask distribution system to cope with the short supply. In April, the emergency COVID-19 relief fund was contributed to all citizens. I got them, yeah. In June, school finally reopened for all students, allowing them to actually go to the school, not online. However, in August, unfortunately, the second wave broke out in the Seoul metropolitan area, Korea's capital. In September, the Korea Center for Disease Control and Prevention, KCDC, was promoted to the Korean Disease Control and Prevention Agency, KDCA. And in October, wearing face mask in public area becomes statutory. By winter, the third wave of infection occurred and more than 1,000 patients were reported daily. The government had to tighten social distancing measures, prohibiting 5 or more people from gathering. During the Chuseok and the Lunar New Year, the biggest holiday in Korea, the phenomenon of mass migration for family gathering from all over the country was no longer seen this last year and this year. As the February 3rd, 2021, there were a total 79,311, at present 8,000 confirmed cases, 1,441 deaths in Korea since the first patient. Next, please have a look at the global COVID pandemic situation. First, COVID-19 cases happened in November 17, 2019 in China, Wuhan, as you know. As of February 3rd, 2021, there were 104 million confirmed cases, 2,262,000 deaths, with the highest number of infection and deaths in the United States. Yes, let's take a quick look at novel coronavirus disease itself. The most common symptoms of the COVID-19 are fever, cough, dyspnea, and altered sense of taste and sense of smell. Less common symptoms such as myalgia, fatigue, etc. may appear as well. In the United States and the United Kingdom, COVID-19 patients having high fever over 38 degrees Celsius or low oxygen saturation less than 94% can be hospitalized. And then those who have advanced severe respiratory failure is transferred to the intensive care unit. In Korea, almost all confirmed cases are admitted to the hospital or residential treatment center. According to the statistics, most common criteria of institutionalization were two or more symptoms in hospital admission, no symptom in residential treatment center. In Korea, in the WHO COVID-19 severity level, mild illness is classified by not having hypoxia or pneumonia. Moderate disease has pneumonia and oxygen saturation over 90%. Severe disease has pneumonia and oxygen saturation below 90%. And critical disease by ARDS, acute respiratory distress syndrome, or septicemia. According to the US NIH, 1% of asymptomatic, 80% have mild and moderate illness, 14% severe, 5% critical. According to the data from KDCA in Korea, 90% were mild disease, 90% were mild disease, and remaining 9.1% include moderate, severe, and critical cases. Now let's get down to main topic, phase of COVID-19 and role of health professionals. This model was developed by myself to understand the phase of COVID-19, which goes through prevention, screening, treatment, and then patient get better, follow-up and survivorship. Patient get worse, end of life care. It's a phase, trend. When patient, during all these 5 phases, patient should be given psychological and socioeconomic support. In prevention phase, physician and public health nurse plays an active role, with officials take on the job promoting and guiding the public. In screening and diagnostic testing phase, physician, nurse, medical laboratory technician are responsible for quick COVID-19 test and correct result. During the treatment phase, physician, nurse are active. Especially intensive care unit nurse plays very important role in managing patients with critical life-threatening conditions. In the follow-up phase, patients were discharged from the hospital, and the role of public health nurse, physical therapist, occupational therapist, clinical psychologist are required. In palliative and end-of-life care phase, the role of nurse, hospice and palliative care specialist, and funeral director are required. In the COVID-19 prevention phase, face mask, social distancing, disinfection, and vaccine are major tasks. In screening and diagnostic phase, body temperature measurement, questionnaire, RT-PCR test, and antibody tests are conducted. In the treatment phase, the treatment modality varies according to the stage of mild, moderate, severe, and critical illness. The role of intensive care nursing is crucial for critical cases. During the follow-up phase, physiological, psychological, social problems may arise, so be prepared to manage them well. When patient with poor progression enters the end-of-life care phase, it is necessary to help the patient to say goodbye properly to family in an isolated situation, to provide appropriate spiritual care. When a COVID-19 patient dies, strictly limited cremation and funeral must be performed to prevent spread of the infectious disease. At this time, healthcare professionals should comfort the family in grief and embarrassment. Let's take a closer look at each phase, starting with the prevention phase. COVID-19 prevention targets all population, all citizens. So education and promotion of the prevention measures are very important. The left is Korean KDCA's proportional material. The right is the US CDC's proportional material. Public officials and the community health nurses are primarily responsible for education and public relations. Face mask is the best preventive measure, as you know. In Korea, KF94 masks are mostly widely used. In the US, medical staff use an N95 masks, and the general public, they cannot get the N95 masks. So, general public is advised to wear 2 masks, putting cotton mask over the surgical mask. He is Anthony Fauci. He wear the 2 masks. In Korea, a 5-level social distancing guideline is implemented with 2-meter distance between any person recommended. Now, there is a game changer in prevention of infectious disease. It is the vaccine. As of February 3rd, the number of vaccination has surpassed the number of confirmed cases. It commenced the counterattack by humans who were attacked by the novel coronavirus. By countries, 35 million in US, 25 million in China, 10 million in UK, and 5 million in Israel was vaccinated. In particular, in Israel, over 50% of the whole country was vaccinated. The effect of vaccine is dramatic. The number of COVID-19 cases is rapidly decreasing. It peaked at 820,000 on January 8th, but reduced down to 370,000 on February 6th. In Korea, vaccinations are scheduled first for medical personnel from late February. Next is the screening and diagnostic test phase. All population are subject to basic screening when entering public and private sites. Body temperature and brief questionnaire are used for initial screening. To confirm COVID-19, a molecular test, RT-PCR, real-time reverse transcription polymerase chain reaction, is performed. Samples are collected with nasopharyngeal via nose, nasopharyngeal swab, and oropharyngeal swab via mouth. In the UK and Japan, this RT-PCR test was conducted only on symptomatic patients whose symptoms persisted for a considerable amount of time. In the United States, it was conducted for both symptomatic and asymptomatic cases, but asymptomatic patients were limited to those who were deemed necessary by medical personnel. In Korea, people can get an anonymous RT-PCR test at a temporary screening clinic free of charge, regardless of symptom. Physician, nurse, and medical laboratory technician performs this screening test. Treatment for COVID-19 is done in people confirmed to be infected with the coronavirus. As for the location of care, in United States, patients with mild disease are treated in hospital, community facility, or at home. The home isolation can be considered for most mild patients. Patients with moderate disease are also treated in hospital, community facility, or at home. The home isolation can be considered for low-risk patients. Patients with severe disease are treated in hospital. Patients with critical disease in intensive care unit. But Korea is different. In location of care for COVID-19 patients in Korea, people with mild disease are admitted to hospital or residential treatment center. Home isolation cases are very low. Patients with moderate and severe diseases are hospitalized for treatment. Patients with critical disease are treated in intensive care unit. Korea has very wonderful healthcare system. People with mild disease receive some symptomatic management such as people with mild disease receive some symptomatic management such as antipyretics to lower a fever or honey to suppress a cough in the UK. In the UK, many patients with mild disease are treated at home. So, sweet honey, you know sweet honey. Honey is suggested to suppress cough. Patients with moderate disease are treated with antibiotics and corticosteroid with or without remdesivir. Patients with severe disease use oxygen therapy. It is very important to provide intensive care for the critical COVID-19 patient. Mechanical ventilation, ECMO, is very important equipment for the critical patient. Mechanical ventilation is used to address severe respiratory failure, and ECMO, extracorporeal membrane oxygenation, should be applied when both heart and lung are not functioning. In ECMO, blood is pumped outside of the patient's body to a heart-lung machine that removes carbon dioxide and sends oxygen-filled blood back to the tissue in the body. Blood flows from the right side of the heart to the membrane oxygenate in the heart-lung machine, and then is rewarmed and sent back to the body. This method is very difficult method. So this method allows the blood to bypass the heart and lung, allowing these organs to rest and heal. For such treatment, competent intensive care unit nurses are key personnel. The Korea National Medical Center opened an ICU, intensive care unit nurse training program for COVID-19 critical patients at 23 hospitals across the country. Through this program, 380 critical care nurses were trained. My research team was in charge of monitoring this project. The ratio of COVID-19 clinical severity in Korea as followed. No limit of activity was 87%. Limit of activity but no oxygen is 3.6%. Use invasive ventilator is 0.2%. Use of ECMO was 0.2%. People who are discharged from the hospital after COVID-19 treatment are eligible for the follow-up phase. More than half of the hospitalized COVID-19 patients have complained of reducing lung function after discharge. This situation is called the post-COVID-19 syndrome or long COVID. In UK, 75% of COVID-19 patients remain symptomatic after 3 months. A survey conducted on 40 discharged patients in Korea shows that 43% suffer fatigue, 35% suffer dyspnea while exercising, and 23% reported hair loss after leaving the hospital. Hair loss is a distinct complaint to Koreans. In the follow-up phase, psychological problems are also significant. Stigma, depression, isolation, post-traumatic stress disorder may occur. The social ostracism is also a problem to take an interest. COVID-19 survivors are stigmatized and suffer from social prejudice and criticism. So some patients choose not to reveal that they have had COVID-19. So it is difficult for them to return to work, and some survivors suffer financial difficulty from shutting down their business or leaving the company. Physical therapists, occupational therapists, social workers, and clinical psychologists are needed to rehabilitate the COVID-19 survivors. Finally, the subject of the end-of-life care phase are dying patients with advanced critical COVID-19 disease. It is very painful to die alone in an isolated room. Patients deserve special consideration, such as saying goodbye to their family via voice or video call on telephone, tablet, smartphone. Hospice and palliative care specialists provide spiritual and psychological support for patients, not physically, just virtually. Family of dying patients with COVID-19 are also very painful and feel embarrassment. Family members wear PPE, personal protective equipment, and go into the world to see the patient not directly, through grass. Write letters or present through grass or listen to their last word via interphone. When a COVID-19 patient dies, he or she cremated first and then has a funeral to prevent the spread of the infectious disease. The whole process can feel unfamiliar and unrealistic because family members have to stay out of the process, unlike traditional funeral. The help from competent funeral director is desired. As discussed earlier, various healthcare professionals are required at all phases of COVID-19. Rather than working alone, they should work together as a multidisciplinary team. The ultimate goal is to prevent the spreading of the novel infectious disease like COVID-19, assist the affected person where to achieve the best result, and stay with them till the last minute if required. There have been many terrifying infectious diseases throughout the human history, from pest to SARS, MERS to COVID-19. The cycle of the new infectious disease appearing is shorter. Just 9 years, 7 years, 4 years. After 4 years, another new novel infectious disease is coming to us. We don't know. But we will certainly face another new epidemic, but we will overcome it again with the power of science, collaboration, and love. Yeah, it's the end. Thank you for, for your attention. Thank you.